what I'm going to ask again, I'll repeat, if you can turn your camera on, we really appreciate to see your faces. It's always great to make that connection. I'll share, someone came up to me at an event Friday evening and they said, "Are you John? I saw your face in that Zoom meeting the other night in the upper left-hand corner." So it may seem weird, but it does work to show your camera and show your faces. So again, I encourage that. I would also encourage you to put your name and your organization in chat, just so that we have an idea who is all here. We're not going to go around and do introductions, but we appreciate getting a sense of who you are and where you are, who you're working with, or where you're from. So please do that as well. Other than that, like I said, if you have any comments or questions throughout the presentation, please feel free to raise your hand, to unmute and ask, dump a question in chat. If there, whatever is the most comfortable way you feel to ask questions and provide comments, this is really always open to a dialogue. Or welcome those who have been here for past meetings. It's been great to see everyone throughout the year. We've really been focused on, and these meetings have really been focused on getting the community and our community partners to understand, the NCACH's mission, how that mission can really become a regional mission and engagement, and then how we're really organizing and operating under that mission with our 3 pillars and engaging the community in that dialogue. So we spent the first quarter focused more on centering around our mission, vision, the pillars that we adopted, what that means for our region. And we've been spending the second quarter building really more of that community engagement and community dialogue piece. And so today we'll have 2 great speakers from Colorado, Patti and David, who Monty will introduce later, talking about understanding, building in civic capacity and community engagement. And it's just great to really hear and see how those components really tie back to health and health equity and the work. We'll also, again, continue with some small group discussions, because really, again, we want to learn from the national speakers and those experts across the nation, but we also want to hear from you guys and see really how we can infuse that work locally. It's really us as a region who is going to make this really effective. And then we'll have some closing and next steps. If you go to the next slide, again, just some working agreements as a whole. This is a dialogue. We're not here to debate or argue. All ideas are welcome, and so we're going to honor time by starting and ending on time. Sharing this airtime for conversation. If you speak a lot, we'll try to hold back a little and encourage those who are normally quiet to speak up more. And really, these are really opportunities to test and innovate new ideas, share thought process. We're not developing a specific action plan, but we're generating ideas and innovations we can do better with as a community. And so any thoughts, any comments, any questions, always encourage you to do that. If you go to the next slide. So again, like I said, a lot of these partner convenings has been really to focus as a region on our new NCACH mission and how we can really bring that mission to life. So as you know, back in 2020, we really adopted a new mission statement focused on advancing whole person health and health equity, and really all the components involved in that. And today, the great thing is when we're talking about civic engagement, also talking about how community engagement and civic engagement can also lead to health and health equity, right? This isn't just a clinical initiative. This isn't just social service initiative, but this is really a community initiative and understanding all those facets that contribute to it. If you go to the next page. And then again, you see our mission and what we're really trying to achieve. What we're also emphasizing is our organization adopted 3 pillars and how we're really operationalizing or committing to bring that mission to life as an organization and ultimately as a region. And you can see on the slide, and Elizabeth, you can progress through, one focused on building on an inclusive process of distributed leadership, are really how are we making decisions as a region together across partners, across communities, not how top down some of the board members of NCACH or key leader or major leaders in the region are making those decisions, but how are we doing it as a community? How are we engaging for tried true community engagement to inform those decisions and move this work forward? How are we as a region working together to anchor and shared measurement, or really how are we partnering together to bring data and data sources to make those informed decisions as we come together under a distributed model? Not one partner in this region owns all the data. Public health owns a wonderful set of data that can support this work. Clinical partners do, social service partners do. I can tell you through narrative stories, a lot of community coalitions have a lot of important data that never ends up in a data set or quality metric. And how are we bringing all that together to move and drive change? And how are we doing it as a region and a portfolio? So as we go through these partner communities, our goal is to look at our mission and use these pillars to really bring that mission to life as a region and as a community. And so each time, each meeting, we try to take step by step a few of those components on how we can achieve and bring this to life and engage you all as community members in that discussion. If you go to the next slide. And with that, I'm going to pass it over to Caroline to give an update.
Thanks, John. So what John just shared on the prior slide is kind of long, slow work, and it's going to take us time to figure out a portfolio, probably not until 2023, to be honest. But this year, there's still work happening, and there's still great things that we can do to move towards this future state. So one of the things I wanted to call out is a funding opportunity that we recently released, and it's completely on point with today's topic of expanding our civic muscle through partnership. We'll spend a little bit more time on this later on for any of you who have specific questions about that application. Sarah plugged the link into the chat if you want to go look at it later. But in short, if you care about improving whole person health and health equity in your community, and you really want to work with partners outside of your sector, then this funding opportunity is for you. Where it's intended to support collaboration and integrated partnerships. And we're accepting applications on a rolling basis because we know that, we don't want people to just whip something together quickly because there's a deadline. So take your time and think about what partners are out there that you could meaningfully work with, whether you want to build a relationship you've already started or whether you want to reach out and start new partnerships. Our board allocated $1.5 million for this. You'll notice in the application that we're not putting a limit on it. It's really based on what you think you will need to accomplish your partnership goals. So we'll, again, spend a lot more time on this later if you have questions, but I just wanted to cue that up as an immediate opportunity to kind of take action on some of the things that we're going to talk about today. And we'll get some inspiration from David and Patti. So we'll move on to that for now, and I'm happy to take questions about this today, but also I'll put my email in the chat and you can reach out to me anytime about this funding opportunity later.
Great. Thanks, Caroline. I'll jump in here. It's great to join you. I'm Monty with the Community Initiatives Network. And just as a little bit of a reminder of the path that's been alluded to, just thinking about January and kind of thinking of this as a bridge year and continuing to start to breathe some meaning into what does whole person, whole health look like from an equity perspective and the mapping. And these last three have really around community engagement. So we had a session, many of you I think were here with us last time around dialogue, and we had 3 outside speakers, and today we're going to really look at civic muscle through partnerships, and we're using a couple of terms that are very comparable. Civic muscle is kind of newer way of looking at civic engagement, civic capacity, those types of things. So I noticed that I'm using those interchangeably. I know that there's some more precise definitions, and I think our speakers will kind of offer, you know, some deeper insight on that. And of course, in June, we're going to talk a little bit about centering on lived experience, although I think Patti and David are going to talk a little bit about, probably might pop up in some of their work. So just as a little bit more context setting, you know, thinking about civic muscle, we've been, over the last few months, I think in different sessions, we've been talking about the vital conditions, which is, you know, one of the emerging ways that's kind of built off social determinants of health and other kind of research and models, but is really a bridging framework for thinking about how we move towards whole people, whole person, whole community health. And so these vital conditions that many of you have been hearing about, just as a reminder that belonging and civic muscle are our sense and our need to feel like we belong, and our ability to feel like we have voice and belong allows us to join with others to, if you will, to engage and connect through civic muscle, how we connect across with residents and community members and different sectors in order to influence change. So all of the work that you've been exploring through distributed leadership and all those are just versions of civic muscle. How do different groups come together to impact their future in positive ways? And so just a reminder that civic muscle is really at the root of all this. As John was saying, we work with a lot of hospital systems and others that are trying to figure out how they support civic engagement in their communities. This is not just about grassroots work. It's how do we create bridges across grassroots and anchor institutions, et cetera. So I think there's one more slide, Elizabeth. Oh, yeah, there's this quote. Harry Boyd was one of the contributors of the Vital Conditions and Thriving Together. And Harry's been a longtime advocate and practitioner of civic engagement with faith communities and leaders, actually worked with Martin Luther King Jr. and around, you know, different ways that we think about local democracy, and just reminding us, you know, that, you know, it's not a task to be completed. That is citizenship in the smallest sense, not necessarily legal, and certainly not to drive to defeat our citizen, which again, I think we feel a lot of that in our culture right now, this very polarized time. It is work, continuous, difficult, often frustrating, yet inherently dignified, personally rewarding, and publicly meaningful work that embodies inclusive democratic ideals for the frankly practical reason that no one outgroup or generation can do it alone. I added alone, sorry about that. So this work that I think we're going to hear a little bit more from Patti and David, when we build civic capacity, it's going to look a little bit different. It's messy and it is rewarding, and we are constantly challenging. What it looked like 30 years ago and what was needed 30 years ago is different than what's needed today and what's needed in, you know, the North Central region. So it's my privilege to introduce two colleagues and friends from Colorado that we've had a chance to work and learn along with over the last couple of years. So Patti Schmitt is the Community Development Director and Director of the Family Leadership Training Institute at Colorado State University. And Dr. David MacPhee they both actually wear a lot of different hats. So I'm not going to go into too much depth, but David's Professor Emeritus, who has done a lot of work with the Prevention Research Center and done tons of work in human development and social sciences, and expert on resilience. And so it's a delight to have both of you here with us, Patti and David. And I know we just kind of wanted to give you some space to just hear kind of how you're thinking about community engagement and what it means to kind of build civic capacity and measure civic capacity in this really interesting emerging tool that I think is gathering attention across the country that you all have been kind of convening around the Civic Capacity Index. So with that note, Caroline said, no pressure, with some inspiration, I'm going to pass it to you, Patti, to inspire us or at least give us some insight. Where are you coming from?
Yeah, and so what I'm going to do is go ahead and invite my colleague David to introduce himself, and then we'll get started.
All right, I'm David MacPhee. Monty gave a crystallized version of what I do. My tenure home is in Human Development and Family Studies, where the Prevention Research Center is housed. I'm currently the Director of Community University Partnerships there. I'm also affiliated with the School of Public Health, largely because of my focus of research on individual, family, and community resilience. And then last year, I had the privilege and the stress of being the interim director of the School of social work on campus. So got my toes in a lot of applied disciplines, all related in my case to community-driven work and inclusion, social justice work I've been doing for 40 years as well. Your turn, Patti.
Thanks, David. Hi, everybody. Really excited to be here today. And just to set the record straight, or to maybe level your expectations, really what we're here today is to learn with you about how we can think about what does good culture of collaboration and working with community look like. And this is a topic that David and I have learned for many years now, that we don't have all the answers, but when we can show up with a lot of questions and be open to where the answers take us, we can really create some wonderful impacts for our communities. So as Monty shared, I am the Community Development Director for Colorado State University in our Office of Engagement and Extension. Basically what that means is I have a really cool job. I get to work with communities across the state of Colorado, thinking about how to address complex challenges in a collaborative way. So I get to work from anywhere from rural to mid-level urban communities, thinking about things like affordable housing, health equity, land use, water use, police violence, vaccine hesitancy. What can we do to create some change in those challenges and do it in a way that creates meaningful change? And one of the things that David and I have really tried to embrace over the years, and our other colleague, David Crislip, who will share a little bit about as well, is this idea of when you can embrace coming to conversations with questions and not really knowing what it's like, what you intend to answer those questions with, you can really create some powerful things. And so with that, let me start my slides. So as I feel like I heard from John, and it sounds like what this group is all about is this idea of no longer do we live in the world where any one person, one organization, one sector can fly in and save us. We really, not to say there aren't bright lights in our communities who are doing incredible work, but what we really need to think about is how we can create cultures of collaboration where people are able across sectors to approach our most complex challenges in a way that involves multiple stakeholders who are impacted by the challenges. And in our work in Colorado, in the roles that we serve and in our research that we've done, we began to look at what we've had the opportunity to work with various size communities, and what we've been able to see is across communities, we've been able to experience communities who are really good at it and communities who aren't so good at it. And so as a team of folks, David, myself, many other partners, and a partner, David Crislip. So you'll hear his name a couple times just because he is one of our co-leaders with the work that we're going to be talking about today, and is really well respected in the nation for knowing and supporting leadership development and civic capacity building. But one of the key questions that we began to ask ourselves is, why are some communities really good at working together, and why do other communities really struggle? And by asking that question and bringing our different expertise together, we began to notice one key thing that was central or at the core of those communities who were really effective. And that was those communities who were able to engage community members at the decision-making table. And not just inviting them to the table, but really thinking about how they could hand over ownership of the strategies and programs that were implemented, involving the community members in the design and honoring the expertise that people brought to the table. And continuing to ask questions and trying to narrow down, so what are we talking about? When we talk about civic capacity or civic muscle building, what are we talking about? Where we landed was we're really talking about how communities learn, plan, and act together, honoring the different expertise everybody brings to the decision-making table, and working together to come with strategies and solutions to complex issues. And civic muscle building, civic capacity, that, to me, that's essentially what we're talking about when we're looking at civic capacity or civic muscle. I will say, though, across the country, there is not an agreement nationally about what we're talking about when we're talking about civic capacity or civic muscle. But for the work that we do in Colorado and for the research that we do, we really have landed on that learn, plan, and act together. So then as partners, we began to say, okay, so we've noticed this about when communities work together. So is there a way for us to measure this? So we can identify some of the items that are holding people back or communities back, and some of the things that are really strengthening communities' ability to work together. And that's where I hand it over to David.
Thank you, Patti. So the way the Civic Capacity Index started is David Crislip in particular asked the question, what would we see if there was community-driven change occurring in various communities? And that question was posed to a panel of 34 experts, defined very broadly. These were academics who had a rich history of studying leadership and leadership development, folks who were elected officials, Wichita's former mayor, a couple of state senators, as well as people who had a great deal of experience on the local level in running organizations, leading organizations that emphasized citizen engagement and service, that kind of thing. So Patti, to go to the next one, I'm not sure where we're at here, but go to the next slide. So let me give you a little bit of background on that. So we posed that question to our panel of 34 experts. They generated 700 or so descriptors about what community-driven change will look like. That was the foundation for the Civic Capacity Index. We winnowed those several hundred down through various statistical techniques to an initial 52-item measure of civic capacity, where there was consensus about the features of that, and a slide in a minute or two will put some meat on that skeleton. We administered it to several hundred folks, winnowed it down to the current 42-item version that has 6 scales. And as of the current data collection, we have right around 2,000 respondents in Colorado, as well as some from the Danville region in Virginia, North Carolina, some from Pratt County in Kansas, and a couple of other folks. So an aside, if you would be interested in taking either the short version of that with 12 items or the longer 42-item version, email me and I can get you the measure. So here's the definition of it. It is strongly grounded in the resilience literature. No small measure. I'm sure that was triggered because we started developing this right before the pandemic hit. And some of our ways of validating the Civic Capacity Index have been in terms of its ability to predict local counties' response to the pandemic and other public health measures I'll get into in just a minute. We have now collected data from 60 of Colorado's 64 counties, plus the 2 other sites I talked about. I have a couple of the urban counties to finish up our data collection with. Colorado, if you're not familiar with it, is a rather diverse state in terms of ethnicity. Rural versus urban, and I say versus because there is tension between the urban and rural sites that have very different views about what civic capacity looks like that I'll get into later. So the reference at the bottom there is an article that the 3 of us published in Rural Connections. It's an extension outlet that we would be happy to provide to you. And we have a couple of other manuscripts either ready for submission or in the works that we can share as well. Next slide, if you will. So the current version has these 6 dimensions to it. There's also a short form, like I said, that draws from each of these scales, and it's very useful, it turns out, turns out, in doing pre-post test measures of intervention work like the Family Leadership Training Institute. You will see here a very strong inclusion emphasis, and certainly the one scale named that, that can get some reaction from people who really don't buy into the notion of social justice. Won't get into details there, but trust me, I get email blowback on that particular scale. But you will see inclusion here across the board, from individual involvement in local governance to coalitions and collaborations among organizations within a community. How does civic culture help the community to address issues, that kind of thing. The utilitarian value of all 6 scales is it can be useful in tailoring how you respond to the needs in the community, what the profile looks like. So I'll pause for just a second to give you a little bit of time to absorb all of this, but I think the next slide, or the one after this in particular, focuses on, or one of the things that stands out is how the inclusion often is an area where communities have a little bit of room for growth. I'll leave it at that compared to the other 5 scales. So the next one, please. So one utilitarian value of the Civic Capacity Index is as a diagnostic tool. One of my activities in the last year and a half has been co-leading with another colleague in Extension the statewide community needs assessment. Civic Capacity builds on that effort as a diagnostic tool that the local Extension folks can use to identify where resources might be funneled into to help build greater civic capacity. So it's helpful in making decisions about where to invest resources, where interventions or support programs might be beefed up. Part of community resilience, the formal definition of resilience, is the ability to adapt to challenges or adversity. That is problem solving. And that's one area of Patti's expertise in particular. Is we don't view the civic capacity as an ends. It's really a means to an end for building civic muscle, to diagnose what local conditions look like, and then to build on that information, sometimes in addition to, for example, scales we've used to validate it, that tap into things like, is it a resilient community? What's the well-being look like? What's the social justice framework and landscape look like? How much trust is there in local governance? And I'll refer to these in a later slide in a second. But essentially what we're trying to tap into is ability to adapt to adversity or crises. What we typically do, always do, when we collect data from a county or a community, is we provide them a graph that looks like this. On the left hand, you see some metrics. These are from the one-item community well-being scale that ranges from suffering to thriving. It's a measure that has worked really well for us in kind of framing it, along with a measure of community resilience that's out of Israel. And this is a very prototypic profile with the inclusion scale, almost always, I can't think of a single exception, being the lowest of them. That tells us that local decision-making could use a little bit more civic muscle in the arena of including diverse voices, however defined. It could be around gender. More typically, it's around race and ethnicity. It could be LGBTQ. We have validated the Civic Capacity Index with the social justice measure that worked very well. It is very strongly correlated to each of these 6 civic capacity scales, but in particular, and no surprise, to the measure of inclusion. And then there's a wide variability in these scales. At the individual level, the ratings vary from 0 to 100 on a 0 to 100 scale. it is highly unusual for a given county to have any of the scales higher than maintaining, not in thriving. I think that's because the bar is set fairly high on a 0 to 100 scale. So it does indicate that the muscle still needs to be developed a bit more, maybe more in some counties than on others. The counties who are in the suffering realm are ones that Patti can talk to a little bit more, but what we have been found out, thanks to Patti's insights, is that those suffering counties often have a deficit, if you will, in terms of trust and connectedness among community members. And so it is our belief that one of the first steps for those in the 20 to 30 range is there needs to have a lot of trust building and connectedness to neighbors happen before they can even really begin to develop these 6 areas of civic capacity. What's the next slide? So several of you mentioned in the introductions about the importance of civic muscle to mental health indicators and other indicators of resilience. So we have a lot of data that not suggests, but pretty much confirms that civic capacity is related to resilience. So here are some details on the next slide, I believe. One of the silver linings, I guess, of the pandemic is that we were able to get the large data set that's available through the New York Times and Johns Hopkins Public Health on weekly, if not daily, case and death rates due to COVID. And we were able to connect that information to not only civic capacity scales, but a number of the validation scales. So on the inclusion scale, the more inclusive the county was, the lower the death rate on the COVID death rate. The higher social cohesion, that's one of the validation scales, the lower the case and death rates. The higher the community resilience, the lower the case and death rate. So what we're finding out from the CDC data is that indeed, both the civic capacity index, excuse me, and these other measures of civic muscle, like social cohesion and community resilience, are predictive in a longitudinal way of COVID death and case rates. I also put together a data file at the county level of various public health metrics. One of my research foci over my career has been child maltreatment and what contributes to that. So we have child abuse case rates, excuse me, Colorado Department of Health and Environment scale related to health being fair or poor, and suicide rates, as well as crime rates. Can't find any connection to crime rates, but the short form of the Civic Capacity Index is correlated, not at high level, but statistically significant with child abuse, poor health, and especially suicide rates. And the latter is predictive even when you take poverty level into account. Poverty explains a great deal of variance in child abuse and poor health, so it kind of swamps the predictive value of the Civic Capacity Index. But the main point here is that inclusive governance and civic muscle, civic capacity, are predictive of these public health indicators at a county level. Mm-hmm. So yes, civic capacity is important if you're looking at various indicators of resilience.
And David, can I just add one?
By all means, yeah.
One level to that. So as a person who directs a statewide leadership program, we always have to tell the story of why leadership development, including more community voices in our processes, is important. And often I am pulled to tell that story, but also to talk about how can we engage community members? I host a meeting, nobody shows up. And what I think this research really tells us, it's not just the right thing to do or something we should do, but it's essential for us to have a strong culture of collaboration and civic capacity within our communities in order to simply save lives. And that, when I saw this research, which David so very well did, my use of words today is really bad, so bear with me. But when I saw this, the results of comparing this data, a light bulb came on, and it's not just something we should do, it's essential to helping families and for saving lives. Thanks, David.
And to tie some of what Patti said together, I have been the program evaluator for the Family Leadership Training Institute that Patti leads for 8 years now, I guess. It is the most impactful program I've ever evaluated. And we've done long-term follow-ups with graduates up to 5 years post-graduation. And one thing that really stands out is their engagement in addressing public health issues in local communities. And we're currently using the Civic Capacity Index in evaluating the Family Leadership Training Institute. Hold on a second.
And I'll fill in while David's talking. So David mentioned the connection between your civic capacity, civic muscle building, and community resilience. I think there's been a lot of focus on resilience and recovery in the last couple of years, and thinking about how do we plan for the next big challenge that's going to happen, the next pandemic, the next larger challenge that will impact regions, will impact states, and will impact local communities. And I think Anita Chandra and many of our health equity specialists, researchers, what they've said is we have to invest in the human capital and the social capital of our communities and support good networks of collaboration.
So you can go to the next slide, Patty, because let's go to the next one. We can skip that one. We already talked about it. So this is where we transition back to Patty. But one framing of the Civic Capacity Index is around social capital, which includes a lot of these elements. And I just want to make a highlight the smaller print on the left-hand side of this slide. One way that we have been validating the CCI, thanks to Patti's observation of how important trust is and feelings of connection to neighbors. We started including a measure of trust and governance, came from the Pew Foundation, and we've always been including a measure of a sense of belonging or connectedness to local community. And the CCI is strongly related to those two measures, like in the upper region of a correlation to those. So it confirms Patti's, I wouldn't say intuition, but observation about the necessity of building trust when we're doing intervention work, especially across sectors, and getting to know neighbors. That links back to the measure and the CCI of coalitions and collaborations, by the way. And so this is where I hand it off to Patti for how do we use this empirical information to do the good work in community strength building, coalition building, that kind of thing. So Patti, might go ahead and talk about what you've got in the graph here.
Yeah, so we understand that data needs to be included in how we formulate our solutions and our decisions around addressing some complex challenges. But what I also think we can do with what we learned from the Civic Capacity Index and from other related data inputs related to social connection, trust building, is we can begin to look at what are our networks, or are the ways that we come together, and how we support investing in strengthening our collaboration at local levels. And 3 of the networks that we are really focused on in Colorado, in order to strengthen what we learn from the results of the Civic Capacity Index, is looking at bonding networks, places where people can connect to people who have similar lived experience as themselves and grow and think about how they want to be engaged in the community and how they can be a part of creating a community. bridging networks, what are the ways that we bring people together across sectors, and then linking networks. This is really how do we bring in our elected officials, our decision makers, so that we're working and creating this culture of collaboration that honors all the different expertise that bring to the table. So I'll just touch briefly on some of the things we've been doing with the results of the Civic Capacity Index, and then just really would love to hear from all of you all about what questions do you have. And one of the things that the index has been used in Colorado is after going through the pandemic, many of our communities have come to my office to say, we want to figure out how to work better together because we're not doing it. We will come to meetings and we will talk about collaboration, we will talk about issues, but then everybody goes back to the organization and really is focused on their mission, on their participants, and the programs that they have to implement. So how can we understand where we're falling short and where we can really strengthen how we work together? And so ideally, we work in partnership to implement the Civic Capacity Index and then host community conversations and co-facilitate those conversations to see what resonates from the results. Does it reflect people's experience? And then opening the door to really good conversations about, well, while you might think we have a really good culture of collaboration in the community, I don't, and here's why. And it's been really telling to open doors to addressing some of the challenges around like inclusion and how we bring people together that have helped support stronger collaborative practices. Another thing that has become very clear with the results from the Civic Capacity Index that essential to any conversation around addressing challenges, you need to have both the content experts, the people who are paid to be at the table, and our context experts, people with lived experience around the issue that you're talking about. Whether it's affordable housing or health equity, it is essential that you have people who are impacted or have been impacted by the challenge. In my role as Community Development Director, I've had the opportunity to work with several communities and committees who are thinking about recovery, whether that's economic recovery or social recovery from the pandemic, and how they were going to spend their federal dollars and federal investment to recover. And one of the things that we've talked a lot with our government partners is thinking about how to use some of that recovery investment in thinking about their engagement plan and thinking about how they can invest in things like cultural brokers and with leadership training that makes sure people are equipped to be at the table and feel like they can be a contributing member to that discussion. And one of the last things I'll just mention is that a lot of folks, when thinking about issues around, it could be a health issue, it could be conversations around better supporting the LGBTQ plus community, it could be around racism. They want to just convene people and bring people together and talk. And what we've found is through the Civic Capacity Index results and through practice of using those results to bring people together is that we really have to invest in building relationships and trust and making sure people have all the tools they need to engage before we bring people together for really difficult conversations. And that has been really powerful and honestly has changed my life because it is in those community conversations from the results of the Civic Capacity Index where I've heard this question. And I'll just leave you with this question, especially since you all are dealing in the areas of public health and clinical health and all health and well-being areas, is at several community conversations, there were people who would stand up and who really challenged us to stop. And what they said was, you want us to talk about this issue. And right now, I don't even feel like I'm a part of a community. What does it mean to be a community? We need to talk about what it means to be a community and what it means for each of us to be a community before we can ever address these issues. And so I loved hearing John share earlier about this is long, or maybe actually I think it was Caroline who shared like this is long term. We know we have a way to go, but we have to figure this out. And I think investing in that long-term, conversation and that opportunity to build people's capacity to be a partner in, any of the areas around health and well-being is an investment. You will see the kind of results that David's research has really pointed out for us. And David and I both shared our emails in the chat, so feel free to reach out to us. We can share the slides, but I'd just open it up if we have time for questions.
Yeah, thanks, Patty and David. And we definitely have time for questions, comments, whatever is being sparked. So we have a group of, feel free to come off your mic or put something in chat if there's something that, again, is question or comment that comes to mind. I might just start with a question, as you all might, as some others might start to formulate some of those. Your last point, Patty and David talked about the Family Leadership Training Institute being one of the most powerful programs that he's evaluated. And of course, I hear that a lot in some of our calls with officials right now, and the couple of calls we've had with the medical school and with public health organizations just around how your Family Leadership Training Institute individuals are now showing up in leadership roles. I was wondering if you and or David could talk a little bit, what is, if we equip folks, what does that look like a little bit? What does it look like to build the tools and skills for dual capacity building? And why do you need to start with that before you just bring people into a room together?
Yeah, I think that too many times in the past, and I can speak to Colorado because that's, this is the state that I know, but I have seen it reflected in other partnerships I've done regionally in the Western states as well, is that too many times we invite people to be a part of the conversation, but we don't invite them. We invite them to the table, but we don't invite them to participate in the conversation. I think some people compare it to like inviting people to the dance, but not inviting them to the dance floor. And by investing in opening doors to training and civic tools to people who might not have access to that training, we're just making sure that people are equipped to fully feel like they can engage in the conversation. David is, I love him. He's a great researcher, but sometimes I'm like, could you define that word you just said for me? Because, that's not the space that I tend to operate a lot in. And so really making sure that we don't talk people out of the room when we invite them to the room is important, especially when we're dealing with some complex challenges.
I'll give you a very mechanistic answer. I think among the many reasons FLTI has the impact it does, extremely well educated, I will almost use the word trained facilitators. It's a rigorous training. They have high standards for delivery. They have a very well worked out curriculum, 20 weeks worth, where they have strong foundational elements that are kind of akin to the Civic Capacity Index, and then a lot of emphasis on how to apply those foundational issues, which is the next step in using the Civic Capacity Index. High dosage, like I said, 20 weeks, and they really work very hard at including diverse voices there and linking up those diverse individuals in concrete ways to the content experts out in the community, elected officials. So I've done a lot of graduate teaching in the area of prevention science, evaluation and stuff, and the FLTI approach is by the books. It's a standard a lot of other community-based intervention programs could emulate. It's unusual to see such long-term impacts also. Usually there's a fade-out effect. The graduates are so energized, get so connected to the community that they have a lasting effect too. So this is not empty praise, it's really description of why the program works. And to use a 4-letter word, and I'm going to embarrass myself every time I tell this, but when I was working with a graduate research assistant who was helping out on the evaluation, I'll blame Amy for this. She said, Dave, those are holy shit outcomes. And I repeated that in a meeting with our local extension folks that Patti was leading with her 10-year-old daughter sitting by our side when I let loose with that description and turned beet red, realizing what I'd said. But I probably evaluated more than 100 programs in my career. Nothing comes close to the impact of FLTI, and there are multiple reasons for it. I think that our guideposts for other intervention programs doing community civic muscle building. Did I use any words that were too esoteric there, Patti? You can ignore the one bad one I said, okay?
Yeah, so what I'm hearing, this is Mike Tuggy from Confluence Health. What I'm hearing is this is really about leadership development, right? And it's getting the right people, and then they can activate the community around the key issues that they're facing. And I think that what you meant, your point too about trust is really incredible. I think one of the things that we saw in the pandemic is that there is an inherent distrust of the healthcare community. Because of the expense and uncertainty and a lot of the press around nobody knows how much things are going to cost, and then the bankruptcies caused by medical expense too. And I think all those things have factored into the trust levels that have really impacted our ability to both take care of patients, but even for people to listen to our advice. I mean, it's really been a challenge.
I'll give you a factual tidbit that I didn't mention before, but the CCI is also significantly correlated with voting patterns. The more a local county voted for Trump, the lower their civic capacity index scores. And given all the literature out there these days, I don't know if it's about the person they voted for so much as the political processes that were being endorsed, including distrust of the public health system. Mm-hmm. So yes, I agree with what you said there.
And Michael, you reminded me of, thank you for that comment, because you reminded me of something that I didn't mention is, in Colorado, over the years, we've, like, our formal government organizations and our healthcare areas as well have burned trust because we haven't had access, for example, for folks who are monolingual Spanish or who aren't comfortable speaking in their English. And so what we found prior to the pandemic was some of the big fires we've seen in Colorado where we don't have 911 reverse calling, for example, in other languages other than English. We feel we've left entire groups of community out. And so the trust is just not there. But what we've found is that when we invest in things like leadership development, those individuals have the trust in communities. So like during the pandemic, for example, we were able to finally get some vaccination clinics going in Colorado because we were able to lean in our grassroots leaders who have trust in the community, who hosted the conversations and brought in some of our health partners, but they were the co-leaders of the conversation. And that's when we really began to see vaccination levels going up in Colorado.
Yeah, we saw a similar thing with one of our physicians from Argentina partnered with some of the Hispanic community leaders in our area, and that partnership really stimulated much more uptake of vaccinations in that community. But prior to that, there was just very slow progress. Mm-hmm. Yeah.
Patti, I was thinking, the other thing in Colorado, which I think is similar around the rest of the country, there's been some real challenges, particularly for farmers and ranchers around mental health. And I think the same thing that we've been hearing in Colorado is having people in those communities. We know that stigma is attached to mental health and different reasons, for different reasons. And we have Joey and others on here that have a lot more expertise than I do, but just having local partners and peers that can open up these conversations is life and death, and opens up all types of possibilities for building partnerships to have those institutions. And I think that we've been hearing a lot of that in some of the recent conversations. So
yeah, and in Colorado, our local farmers and ranchers have really struggled with, the impacts of the environmental disasters on their livelihoods. And, in a small town, everybody knows who the therapist is. And so everybody knows whose truck is whose truck. So if they see your truck at the therapist clinic, they know that they're going to be judged. But, potentially, utilizing like our extension offices as a place to get information and get support, and being able to ask questions that they might not be comfortable asking at the therapist's office has really helped to bridge and make more accessible or more willingness to access mental health services in Colorado.
all right, well, we're going to pivot in just a minute or so. I want to make sure if there's, yeah, please.
Yeah, this is Nancy. As I'm listening to this conversation, and I've been thinking about this a lot lately, is this, and this was said back earlier, inviting to the table. And I struggle with that a little. And in that, what I'm saying is that what table are we inviting people to? And does it look like what this space looks like right now? And is it really and that's why I think the engaging and the training piece is important, because it's not I'm not sure it's about inviting to, it's about going out.
Going out.
Or going into spaces that we may be uncomfortable and whatever, right? Because I've tried all that, like we've said. I have these meetings and nobody shows up, or I have meetings and certain people I invite come, but they don't continue to come because they don't find space in that meeting. So I think there's a lot of training and understanding that we need to have around that process.
Yeah, I view that particular phrase as a shorthand for inclusive governance. But one of my all-time favorite books of any kind is Lisbeth Shore's book, Within Our Reach. It's a little bit dated now, 1985, but she went on a nationwide year-long tour to find out what makes the most effective community organizations and intervention programs work so well. And one of the 14 principles revolved around access. How late are their hours? Do they have on-site collaborations with community leaders? Do they provide food during meetings? Do they have translators? That kind of thing. So it's, I guess I would say, a paragon of inclusive governance where they deliberately make it accessible, not by holding it at City Hall, but in local community-based organizations. University of Minnesota does a lot of resilience work where they have opened satellite clinics in neighborhoods. And that's where the decision-making happens, and along with the services. So I 100% agree with you. And if you want kind of an academic justification for that, Lisbeth Shore's book is a really good place to start.
And like, this is why I always say I love learning with people and with groups, Nancy. I think, you're absolutely right. And that's what I suggest to my city and county government folks that I work with a lot, is instead of expecting this large group of people to convene together, really think about where is the convening already happening in the community, and seeing if you can create a relationship with those folks to add to or be a part of that conversation. So I am going to work on changing the way I describe that for the future. So thank you for that, Nancy.
Yep, appreciate you giving voice to that, Nancy. And I think it's a, yeah, it's a question that we're all continuing to wrestle with around how do we start to create radical hospitality and inclusion. It's not necessarily always inviting folks to our table. It's finding all these other creative ways. And Patti and David, I just again want to thank you for being so generous and sharing. I think you've implied in your offering that if folks want to take a closer look at the Civic Capacity Index, you know, the CHIs or others that might want to actually do this to see what new conversations around patterns and capacity building might come out of that, could be really interesting. And I think the other piece the takeaway is, you know, this isn't just a nice to do. It's not the right thing to do. This is a real difference maker in kind of the world that we're facing. It always has been, but particularly now, given some of the challenges that we need to respond to at local levels. So thank you for being here. And I think we were going to just have a chance to kind of turn into smaller groups like we've done the last couple of times, you know, no more than 15 minutes, maybe a little bit less than that, to give you a chance in smaller groups to just, you know, what's bubbling up for you. You know, Nancy, you offered up some of your experiences of what didn't work. You know, be curious, are there some other places across groups of differences across, you know, what has worked when you brought different groups and different institutions together? If you have any experience on that, what made it work? And what might, you know, this network actually do to really build capacity, to really think differently around building the civic muscle and civic capacity? So you can take the small group questions wherever you like. I think those are the two, and we can put those into the chat. Elizabeth, I hope I got those right. Thank you for that. And I think we are going to be taken just magically just for, you know, about 10, no more than 15 minutes into small groups, and we'll come back and see what's servicing. And I think Caroline's ready to talk a little bit more about the funding might have come out of your small group discussions of things that you've been learning based on experience, or things that you could imagine that could be done through this network around civic capacity building. What jumped out for you? And Patti, you're still with us. That's great.
We talked in our group about identifying, trying to work on identifying the leaders within these sub-communities where work needs to be done and where collaborations need to occur in order to, and then figuring out, like, how do we get those people trained up into their roles so that they can actually bring in the trust component when other collaborating organizations that may not have that trust in that community can working with that leader can help build trust as we're trying to work with those, you know, tackling individual problems.
Yeah. That's great. Did you have any examples, ideas in mind around particularly, you know, who are voices and perspectives that would be priority to really be including and bringing in to some of those processes? Well,
yeah, I mean, like Joseph was talking about, you know, his work with the drug rehabilitation work and getting the, you know, identifying members of the community who are in that community who go through the training, and then they become the kind of the center point of intervention there. So it's really, that was more ethnically based, you know, identifying that. And then, you know, I'm thinking about in our community, just our frail elderly problem, and, you know, finding leaders within the senior community who are getting engaged in volunteer work and things like that, who can serve as trusted advisors for others in their age group about, you know, who should they be listening to for help with their planning as they're aging in place, things like that.
Yeah, thank you for that. That's great.
I just thought it was really interesting in our group. A lot of our talk was kind of around, maybe we get these people to the table, but you always have the same few people who are, yes, I'm going to do everything. I'm always willing to help out with a task. And then you have all these other folks who are there, but not necessarily engaged and not willing to take on any roles or tasks, and how to kind of navigate that piece where it's like, yes, you're at the table, but just because you're sitting here doesn't mean that you're actually contributing anything. And so trying to figure out how to balance people's time and priorities, especially when almost all of us are really limited in our resources and capacity, was really interesting, because you can always tell the people who are like, oh yes, I'm totally going to help out with that, I'm going to volunteer to work on this project. But when it's the same 3 people every single time, and you're not able to kind of use the resources of your other partners, it becomes really burdensome.
Thank you for that. I'm curious, did you all have any insight around how to overcome that, I think, classic challenge that a lot of us can relate to?
I think one of our ideas was just kind of the people who are constantly saying yes to just not say yes. Just be like, I don't have the capacity to do this and somebody else needs to do it. I know that something that typically happens in a lot of the projects I've worked on is when the yes person says no and nobody else is willing to volunteer, we start to volunteer people to take on some tasks, which isn't always great, but typically it's that little nudge that a lot of people need to realize, I do have the capacity to do this. It's 5 minutes of my time. I can take on that task.
Mm-hmm.
Yeah, and we, just to build on that, said, by inviting others who maybe don't say yes all the time, that, just saying, let's try this. Why don't you, do this small part of the project, and then, maybe you'll have, find that you actually do enjoy that work and that you can build on top of that. But it's trying to just get them to at least take a little bite out of the process and the work so that they can find their place in it.
Mm-hmm. Thank you.
Well, Patti, I have a question for you, because in our breakout, I was sharing that even with the ACH and the Coalitions for Health Improvement, we've often talked about community engagement. And then what do we actually mean by that? Do we mean partner engagement, or do we mean resident engagement? And it seems like we're always all getting stuck on the resident or like community engagement, that the resident engagement. And I was curious to learn from you what you mentioned, your leadership development program, but like, what does that look like? Is it trainings? Is it workshops? Who's it for? I'm just curious to learn more, especially as I was thinking about, what the ACH could do to bring in not just multi-sector partners, but also that community element to planning and action.
Yeah, so we experiment all the time on how to make sure everybody has the tools that they feel like they could engage. Caroline, I think in our small group that I was in, we were talking about how do we provide training for folks who are more on the content expertise side of things on how to more effectively engage in partnership with community. And so for us, we look at how do we make more educational opportunities accessible to people on leadership development and civic engagement, or civic tools that help people step into leadership roles, and then challenge people and coordinate with people to get people and lift people up into those positions. And then on the other side, we are trying to invest in increasing the capacity of our decision makers and our organizations to better partner with and hand over power to community members, and feeling a little more comfortable showing up without all the answers. Did I get out what you were asking, Caroline?
You did, and I will follow up with you to get more details, just because I'd like to just learn more and see if that's something we could invest in as an ACH for our regional partners. And so I'll follow up with you, Patti.
Yeah, and I will say that I haven't met anyone who really has that figured out.
Right.
There's a lot of people doing some great experimentation with it, but I think it's a newer side of thinking about these kind of collaborative multi-sector approaches.
Yeah, Patti, I'd be curious, kind of going off Caroline's Because part of it's right, like you go to the tables or you engage in that, but sometimes people don't feel confident to have the skill set to be the leaders. So it's like, how do you build that skill set into individuals so that you can let go and allow others to step up and shine versus feeling like you have to be the leader all the time?
Mm-hmm. Yeah, I would say that we have to train ourselves to let go too. I'm a control freak, a parent of two, and like I'm always like, I'm gonna take care of that. But like it really is constant training and reminding, like I've got to let go. I've got to let go of controlling how we name it, what we decide to do, and just let it, whatever bubble up and see where it takes us. So I think it's training on both sides. There is, and I forget, I apologize, I forget, I think Sarah was talking to this, and then the other, maybe Katie was mentioning this. I've been toying around with this idea of catalyst makers. So we have coordinators who support really inviting people into community leadership positions so that we don't get the same 3 people showing up and taking leadership, but really encouraging and supporting people as they exercise or get out of their comfort zone so that they don't feel alone. I think that's another important role many of you can provide in community is how can you support other people's leadership? By letting go, but then also encouraging and inviting as well.
So Patty, the FTLI program has been really intentional. I know in some of the food system work that we've done over the years, I was always impressed because I think some of the groups that are attracted to it that you all recruit for are folks that have been on the margins, who have been underheard voices that have not had a lot of power, but it's been inclusive of a lot of different life experiences that have been part of the program, I think. And I know that's also quite a commitment. And, you know, it sounds like there are some other, you know, whether people go through a 20 sessions, but there's also some lighter ways that still build some capacity that for folks to host conversations, to be catalysts that you all been experimenting with. Is that accurate?
Yeah, so in addition to the 20-week grassroots leadership program that we also have what we're calling a Civic Learning Lab, where we work with local communities, neighborhoods, groups who are like, we need to do something, and empower our community members to mobile home preservation is a big thing in Colorado. Is we're really trying to preserve our mobile homes because it's one of our biggest assets for affordable housing. So we can create these tailored leadership and civic labs for specific groups and communities outside of our 20-week evidence-based curriculum that really is tailored to support where growth is needed and the learning objectives of the specific group related to leadership and civic engagement. So getting out of your comfort zone, using your voice is a huge one that a lot of community members will talk about wanting to learn more about, and storytelling as a way to create change. Those are a lot of things that we do work around.
Mm-hmm. And you could share some of that with the group. You're not making a fortune off this, and you've patented this and a lot of intellectual property. Is that true?
So yeah, the 20-week curriculum comes from our national partners. In partnership, we've tailored it for Colorado, but that's a copyrighted curriculum. But we've worked with several folks and community members and local facilitators to create our Civic Learning Lab curriculum content. And we are determined for that to be community owned, but we do ask that anybody who utilizes that content is trained by our facilitator trainings to make sure it reflects the values. And we're driven by equity and inclusiveness. And so we want to make sure whoever's facilitating that content is really driven by those same values.
Last question. I know that Mike Gaffney, who is at Washington State, is one of our colleagues. Are there other folks? I don't know if there's extension partnership with North Central, or if there's other connections given extension linkages here.
Yeah, I can't think, Mike is great. So if you're looking for doing some great work in Washington, he's a great extension partner. There is a college in Washington State that has a similar FLTI program called the Parent Leadership Training Institute. It's not just for parents, but that's the historical national name for it. And I was trying to think of where they're based out of, but I couldn't think of. So I'll find that out and I can send that to Monty to share with you all.
Okay.
So I just had a thought, and this is only a thought. I hadn't even thought through how that might, it's just it came to mind. But wondering how some of this could be connected to grant opportunities in providing funding for different projects, and in particular, like the content experts being part of the project, or just some way that it's prioritized, that because let's all be honest here, money gives power, right? and it gives projects power, and having a say about how that money is spent gives power. Anyway, just a thought.
Yeah, Nancy, to your point, we may not be able to always, control how each individual organization operates individually, but as we work together as a collective, that set ideal of what it means to work together and what do we all agree on, that we can control, including how we engage our community. Or we may not be able to control, but we can get people behind and try to get that individuals understanding how we move together as an ACH in a region.
Well, and Monty, this might be a good segue back to the funding application, because Nancy, on that application, there is a question in the narrative that we're asking applicants to answer, which is, what role did community members play in shaping your proposed solution, and how will they be involved in the implementation? And so that's kind of encouraging to really think through like how they went about that, and if they haven't yet, then seeing that question hopefully will motivate them to think a little bit about how they might engage community as they think of their cross-sector partnership ideas. And we'll see where that goes. I don't know if that's where you were getting at, Nancy.
Yeah, I'm thinking about with that answer, what is the prioritized criteria that you want from that answer, right? Is it just, oh, we held 3 meetings and invited people to the meetings, right, to find out what they think?
Mm-hmm, mm-hmm.
Or is there some type of rubric or till I teach at a college, but or some way to prioritize what that answer looks like?
Yeah, and honestly, we don't have a rubric in mind or like priority criteria for how we would rank that response, but I think it's something that the way this funding process will work, and sorry, Elizabeth, I know you're scrolling and it's actually on the last page, question number 5, so I think you have to, there you go. Nancy, I think an opportunity for anyone applying too is so that they're encouraged to submit kind of concise responses to these questions, but that's just the beginning, and like the real conversation happens in kind of a panel interview format. And I think this is an area where we could talk it through, and we could even ask, like, if they're feeling stuck on how to do that, we could ask, like, well, what kind of support or assistance might you need? And it's not that we know or have the answers either, because quite honestly, we struggle with it as an ACH too, but at least we would open up that conversation, and then maybe, reach out to Patti and see if she has ideas, and other folks that we've kind of brought into our network from outside Washington State. But yeah, I think it's, if we don't ask it though, and in past applications, we haven't always asked this, so it's easy to then just gloss over and overlook and not even have any kind of community engagement. So it's a step in the right direction, hopefully, but I'm sure we will learn whether it's hitting the mark or not. And I'm hoping that it'll lead to good conversations with applicants.
Well, I think it's a way, if it becomes a standard way of asking those kind of questions, it becomes something that then organizations begin to think about because they know to get funding, they have to answer those kind of questions.
Yep, exactly. Well, so if anyone has questions about the application, I'm here to answer them live right now if you have any burning ones. If you prefer to ask your questions offline, you can reach out to me via email or phone call. All my information is in the application. And again, we just released it at the beginning of this month. It'll be open on a rolling process. And I'm just curious to see how many people apply. I know that cross-sector partnership is hard. So I actually think that we're just going to get a little bit of uptake at the beginning and hopefully it'll build over time, but we'll see. We're ready to learn to see what kind of response we get. Are there any questions from any of you joining today, specifically on the application process? I'll just pause for a bit. And we probably we'll keep doing some communications outreach about this funding opportunity because we want to make sure everybody saw it. And I think at this point, it sounds like there aren't questions. So Monty, we can turn it back to you.
Yeah, well,
and
Caroline, as I say, it seems like a really great opportunity. I mean, as you know, Nancy, I really love your ideas around, even if there's some small steps, how do we start to norm around these questions that we're asking around engagement and whose voice and how we're sharing power? These are the things, I mean, Patti emphasized at the beginning, what is a culture? I mean, ultimately, that's, I think, what the North Central is trying to do is change a culture in how we think about solving problems, who's engaged in this problem solving, how we're doing power. And my takeaway from a little bit of the conversation is, we think that just inviting people to the table, this is going to happen magically. And we have to be super intentional, and we may not invite people. We may be at the wrong tables. We may need to humbly go to some other tables. We may need to have other people that are really leading these conversations. And we just, you know, we stub our toes so often because we are not intentional around what civic capacity and muscle building. And, you know, as Patti and David remind us, it means a lot. It's not just a nice thing to do. It makes the difference between getting real outcomes. I think we all kind of know that, but in any event, I just wanted to, on the behalf of the group here, thank you, Patti, for being here with us and for, you know, willingness to hopefully continue to stay engaged and keep us surprised of what goes on with the Civic Capacity Index and other work. And I think, John, oh, great, Sarah.
Yeah, I'll to close us off, I have just two things. One, I just wanted to give Mariah an opportunity to share feedback on an upcoming waiver that is coming through the Washington State Healthcare Authority, where we actually want some feedback from our community, and then I'll have some closing thoughts. So I'll pass it to Mariah quickly, if you are ready, Mariah.
I guess it helps to unmute yourself. I'm going to share in the chat. We have last week a MailChimp went out. Not sure if any of you saw it, but we looks like both the links went in one message there. So there's two links. But we shared that the Healthcare Authority is applying for a waiver renewal for the Medicaid Transformation Project. And the renewal feedback period, the public comment period, opened last Thursday, and it will run until June 13th. So if you have any desire to provide feedback, those are some of the resources. And then I will go ahead and drop in the actual SurveyMonkey. So we created, or maybe Sarah already has it highlighted, ready to drop in. So we created a SurveyMonkey so that our region can provide feedback directly to us that we will then compile and provide to the Healthcare Authority. So if that's the option you prefer, there is the SurveyMonkey link, and then the links above will provide you with some of the information. There is a link to a recorded presentation that Michael Arness from the Healthcare Authority presented to our board at the May board meeting. Then there's some other background resources there so that you know what you're providing input and feedback on. So again, that runs until June 13th. and we would love some feedback from our region. And you can, again, provide that at the SurveyMonkey link, or there's also a survey that HCA has developed. You can directly send it to HCA, or you can even email HCA directly. So we just wanted to plug that in so that our region knows that we are, we value your feedback and participation in shaping a current waiver renewal. So thank you.
Thank you for sharing, Mariah. And if anyone has the opportunity to look at it, feel free to email us if you have questions, or please complete the survey. So 2 parting thoughts I just have, and this came from comments Patti shared in our small group when we were talking about cross-sector partnership 1. And we were talking about how hard sometimes it is to partner together across sectors or to bring in community engagement. She just emphasized that ultimately it may seem hard at the start and it may seem a little bit more work, but in the end, it ends up being more efficient and more effective to really gather that community feedback to figure out what the community really needs, instead of repeating that process over and over and making those guesses, and really working across partners to utilize that efficiency in what each partner brings versus trying to create it yourself. So it can seem daunting at times, but in the end, it's better for all, and even better for the efficiency of the partner. So I encourage you guys to always keep that in mind, knowing that in the end, that's always important. And then another thing that Patti brought up in our small group, when we were talking about, letting go, she recognized the fact that a lot of times leaders expect or feel that they have to come with the answers. And sometimes, to be honest, are always rewarded when they bring the answers. And so that's really a cultural thing that I challenge everyone to always kind of focus on and switch, even as an ACH. Nancy and Dr. Tuggy, I'd encourage you as board members to challenge yourselves and challenge us on that, and then everyone else as community members when we do this work. I encourage you to challenge us and push on that, right? To be a leader isn't always to have the answer, but to help support others in growing and developing and crafting that answer together. And so really, that challenge is, how do we develop that culture internally and as a region? That leadership means supporting the community and coming together to develop the solution, and not always being the one with that solution. So I leave you guys with that partner, or that parting thought. And I just want to thank everyone for attending. The next partner convening in June. Does someone have a link they can dump? Perfect. I think that's Sarah, you dumped the link in the chat for the June convening. So if you want to register and get that on your calendar as well, the link is in the chat. And otherwise, thank you again so much for joining. We will share the recording out when we get it downloaded in a couple of days at least. And